Hello, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to go over a few exercises that you can do if you have arthritis in the knee and find exercising difficult. One of the worst things you can do when you have arthritis is to stop exercising. You want to keep the muscles around the knee strong, so in the event that you would require surgery, you are already in good shape in order to be able to handle that. Also, the better shape you are in, the less pressure that is on the knee. And that will help minimize the arthritis and how much pain you're going through. These exercises that we're going to show you can be done on land, and they can also be done in the water. So if you find exercising in the water a little bit more refreshing and not as difficult because you are not bearing all of your weight, you can certainly do that. These exercises are easy and gentle enough that you can do them every day. They are not a complete set of exercises, but if you're just starting out and you need something to do, these are going to be good exercises to do. You can add weight to these to make them more challenging. You can do them laying down to make them more challenging, but these are going to concentrate on the muscles of the hip, which you need to keep strong because a lot of those muscles come down and then attach at the knee. So these aren't designed to inflame the knee in any way. They're just designed to keep the hip strong, to keep the pressure off the knee. One of the tricks that you can do when you have arthritis is make sure that when you stand, you're constantly moving. So you look like you're fidgeting, you're moving back and forth. So you're allowing good fluid to flow into that joint and to keep it fresh. And another thing you can do is to keep a slight bend in your knee. When you do that, you're taking the pressure off the ligaments and you're allowing that joint again to have some good fluid that moves through it. So there are 4 hip exercises that we're going to show you today. Again, you can do these standing, laying down, with weight, without weight, or you can even move them into the pool if that's a possibility for you. The first one we're going to do is hip abduction. So you're just going to start by standing and moving your foot out to the side and back in. You may need to hold on to a counter to do these if you feel you're going to fall over. You want to do 30 on one side and then 30 on the other side. The next exercise is going to be hip extension. And again, you can stand at a countertop and hold on, but you're just going to kick your leg back, nice and easy. If you feel any pain in your hip or your back, you should stop those. The next one is hip adduction. So you're just going to start in standing and you're just going to kick your leg right across your body and then come back. This is a good one if you have a piece of tubing or band at home. You can tie that around the bed and do this. And the last one's going to be hip flexion. So again, you can hold onto a countertop and all you're going to do is kick your leg nice and straight and back down. You want to kick it as high up as you can, but you want the movement to be controlled the whole way through. You don't want to swing your leg up and let it fall down. You can also work on balance. Just standing on one leg, eyes open, eyes closed. That will help keep the knee fluid and functioning properly. If you have any questions or would like to be evaluated for knee arthritis, please call 215-997-9898.